Gouty arthritis. Gout is a common and complex form of arthritis that can affect anyone. An attack of gout can occur suddenly, often waking you up in the middle of the night with the sensation that your big toe is on fire. The affected joint is hot, swollen and so tender that even the weight of the bed sheet on it may seem intolerable. Doctors place gout under the term arthritis, a broad range of joint diseases and joint pain. Some forms of arthritis inflame joints, while others don't. Gout is a common form of inflammatory arthritis. It's due to a crystal called uric acid. Uric acid is a breakdown product of purines that are part of many foods we eat. An abnormality in handling uric acid and crystallization of these compounds in joints can cause attacks of painful arthritis. Gout causes pain and swelling in one or more joints. It typically affects the big toe, but it's also found in other joints, including the knee, ankle, foot, hand, wrist and elbow. It also leads to kidney stones, and blockage of the kidney filtering tubules with uric acid crystals, leading to kidney failure. Gout has the unique distinction of being one of the most frequently recorded medical illnesses throughout history. There is no cure for gout, but you can effectively treat and manage the condition with medication and self-management. Gout flares start suddenly and can last days or weeks. These flares are followed by long periods of remission, weeks, months, or years, without symptoms before another flare begins. Gout usually occurs in only one joint at a time. Who is affected by gout? Gout can affect anyone. It usually occurs earlier in men than women. It generally occurs after menopause in women. Men can be 3 times more likely than women to get it because they have higher levels of uric acid most of their lives. Women reach these uric acid levels after menopause. People are more likely to get gout if they have obesity, or a lot of extra weight. You are also more likely to develop gout if you consume a diet high in animal proteins, consume a significant amount of alcohol, having certain health conditions, including congestive heart failure, diabetes, hypertension, high blood pressure, kidney disease, metabolic syndrome, if you are on water pills, diuretics, or have a family history of gout. Eating or drinking food and drinks high in fructose, a type of sugar. Having a diet high in purines, which the body breaks down into uric acid. Purine-rich foods include red meat, organ meat, and some kinds of seafood, such as anchovies, sardines, mussels, scallops, trout, and tuna. Risk factors for gout. You're more likely to develop gout if you have high levels of uric acid in your body. Factors that increase the uric acid level in your body include 1. Diet. Eating a diet rich in red meat and shellfish and drinking beverages sweetened with fruit sugar, fructose, increased levels of uric acid. 2. Certain medications. Low-dose aspirin and some medications used to control hypertension. They include thiazide diuretics, angiotensin-converting enzyme, ACE, inhibitors and beta blockers. They can increase uric acid levels. 3. So can the use of anti-rejection drugs prescribed for people who have undergone an organ transplant. 4. Recent surgery or trauma. Experiencing recent surgery or trauma can sometimes trigger a gout attack. 5. In some people, receiving a vaccination can trigger a gout flare. Is gout hereditary? Gout is at least partly due to heredity. Researchers have found dozens of genes that increase people's susceptibility to gout, including SLC2A9 and ABCG2. Genes associated with gout affect the amount of uric acid the body holds onto and releases. Because of genetic factors, gout runs in families. People with a parent, sibling, or other close relative who has gout are more likely to get it. It's likely that genes only set the stage for gout. Environmental factors, such as diet, actually trigger the disease. Acute gout attacks are characterized by a rapid onset of pain in the affected joint followed by warmth, swelling, reddish discoloration, and marked tenderness. The small joint at the base of the big toe is the most common site for an attack. Other joints that can be affected include the ankles, knees, wrists, fingers, and elbows. In some people, the acute pain is so intense that even a bedsheet touching the toe causes severe pain. These painful attacks usually subside in hours to days, with or without medication. In rare instances, an attack can last for weeks. Most people with gout will experience repeated bouts over the years. The joint at the base of the big toe is the most common site of an acute gout attack. The pain, swelling and other symptoms are the result of a defense by the immune system against uric acid crystals in the joints. This attack leads to the release of chemicals called cytokines, which promote painful inflammation. People may experience gout with deposits of uric acid crystals in their finger joints. To ease the pain during a gout attack, rest the joint that hurts. Gout can also attack joints such as the elbows and knees. Diagnosing gouty arthritis. Gout is considered when a patient reports a history of repeated attacks of painful arthritis, especially at the base of the toes or in the ankles and knees. The most reliable test for gout is detecting uric acid crystals in the joint fluid obtained by joint aspiration. This common office procedure is performed with topical local anesthesia. Fluid aspiration. Using sterile technique, fluid is withdrawn, aspirated, from the inflamed joint with a syringe and needle. Analysis. Once joint fluid is obtained, it is analyzed for uric acid crystals and infection. Your doctor may also do a blood test to measure the amount of uric acid in your blood. Doctors usually diagnose gout based on your symptoms and the appearance of the affected joint. Tests to help diagnose gout may include blood test. Your doctor may recommend a blood test to measure the levels of uric acid in your blood. Blood test results can be misleading, though. Some people have high uric acid levels, but never experience gout. And some people have signs and symptoms of gout, but don't have unusual levels of uric acid in their blood. X-ray imaging. Joint X-rays can be helpful to rule out other causes of joint inflammation. Ultrasound. This test uses sound waves to detect uric crystals in joints or in tophi. Dual Energy Computerized Tomography, DECT. This test combines X-ray images taken from many different angles to visualize uric crystals in joints. What causes gout? The human body makes uric acid during the breakdown of chemicals called purines found in certain food and drinks. This normal byproduct goes through the kidneys and exits the body when you pee. Sometimes the body produces too much uric acid, or the kidneys can't do a good job handling it. When the body has high levels of uric acid, or hyperuricemia, uric acid crystals can concentrate in the joints. The sharp, needle-like crystals cause gout. However, many people with higher uric acid levels never get gout. Gout occurs when uric crystals accumulate in your joint, causing the inflammation and intense pain of a gout attack. Purines are also found in certain foods, including red meat and organ meats, such as liver. Purine-rich seafood includes anchovies, sardines, mussels, scallops, trout and tuna. Alcoholic beverages, especially beer, and drinks sweetened with fruit sugar, fructose, promote higher levels of uric acid. Complications of gout. People with gout can develop more severe conditions, such as recurrent gout. Some people may never experience gout signs and symptoms again. Others may experience gout several times each year. Medications may help prevent gout attacks in people with recurrent gout. If left untreated, gout can cause erosion and destruction of a joint. Advanced gout. Untreated gout may cause deposits of uric crystals to form under the skin in nodules called tophi. Tophi can develop in several areas, such as your fingers, hands, feet, elbows or Achilles tendons along the backs of your ankles. Tophi usually aren't painful, but they can become swollen and tender during gout attacks. Kidney stones. Uric crystals may collect in the urinary tracts of people with gout, causing kidney stones. Medications can help reduce the risk of kidney stones. Can I prevent gout? You can make certain lifestyle changes to help prevent gout. Drink plenty of water to help your kidneys function better and avoid dehydration. Exercise regularly to stay at a healthy weight. Extra weight increases uric acid in your body and puts more stress on joints. Do your best to limit the purines in your body, since these chemicals can trigger uric acid buildup. Foods and drinks containing high purine levels include alcohol, red meat and organ meats, liver, shellfish, gravy. Drinks and foods high in fructose, fruit sugar. Protein from animal sources. All protein from animal flesh can potentially lead to elevated uric acid levels. Certain medications can lead to elevated uric acid levels. These medications include diuretics, also known as water pills, immunosuppressants, or drugs used to slow the immune system, common in organ transplants, for example. Lifestyle and home remedies. Medications are often the most effective way to treat gout attacks and prevent recurrent symptom flares. However, lifestyle choices also are important, and you may want to choose healthier beverages. Limit alcoholic beverages and drinks sweetened with fruit sugar, fructose. Instead, drink plenty of non-alcoholic beverages, especially water. Avoid foods high in purines. Red meat and organ meats, such as liver, are especially high in purines. Purine-rich seafood includes anchovies, sardines, mussels, scallops, trout and tuna. Low-fat dairy products may be a better source of protein for people prone to gout. Exercise regularly and lose weight. Keeping your body at a healthy weight reduces your risk of gout. Choose low-impact activities such as walking, bicycling and swimming, which are easier on your joints. Gout home remedies. Some home remedies may help lower uric acid levels and prevent gout attacks. The following foods and drinks have been suggested for gout: tart cherries, magnesium, ginger, diluted apple cider vinegar, celery, nettle tea, dandelion, milk thistle seeds. But these alone may not be enough to manage gout. Gout essential oils. Essential oils are plant-based substances used in aromatherapy. Some oils are thought to have anti-inflammatory, pain-relieving, and antibacterial effects. Some of the essential oils used to treat gout include lemongrass oil, celery seed oil, yarrow oil extract, olive leaf extract, Chinese cinnamon. Be sure to follow these safety precautions when using essential oils. Don't put essential oils directly on your skin. It's important to dilute them first with a carrier oil such as coconut oil or jojoba oil. For example, for a 3% dilution, mix 20 drops of the essential oil with 6 teaspoons of the carrier oil. Ingestion of oils. Don't put essential oils in your mouth, since they're not safe to ingest. Gout alternative treatments. As with many alternative treatments for any disease or condition, opinions are often mixed as to how well such treatment methods work. Foods, herbs, and supplements. The following have shown at least some promise for gout. Coffee. According to the Mayo Clinic, there's evidence that drinking a moderate amount of coffee a day can lower gout risk. Antioxidant-rich fruits. Dark-colored fruits like blackberries, blueberries, grapes, raspberries, and cherries can help keep uric acid under control. Vitamin C. Consuming moderate amounts of vitamin C is also connected to lower uric acid levels. However, very large doses of the vitamin can actually raise uric acid levels. Other supplements. There are also herbal supplements that have been found to effectively reduce inflammation, including devil's claw, bromelain, and turmeric. These haven't been specifically studied for gout, but they may help with the swelling and pain associated with an attack. Acupuncture. This technique, which is a form of traditional Chinese medicine, involves placing very thin needles in points on the body. It has been found effective in treating different types of chronic pain. There haven't yet been any studies done on acupuncture and gout, but its pain-relieving properties are promising. Hot and cold compresses. Switching between a hot compress for 3 minutes and a cold compress for 30 seconds on the affected area can help reduce pain and swelling that occurs during a gout attack. How is gout treated? Manage the pain of a flare. Treatment for flares consists of non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, steroids, and the anti-inflammatory drug colchicine. Colchicine. Your doctor may recommend colchicine, Colchris, Gloperba, Mitigare, an anti-inflammatory drug that effectively reduces gout pain. The drug's effectiveness may be offset, however, by side effects such as nausea, vomiting and diarrhea. Corticosteroids. Corticosteroid medications, such as prednisone, may control gout inflammation and pain. Corticosteroids may be in pill form, or they can be injected into your joint. Side effects of corticosteroids may include mood changes, increased blood sugar levels and elevated blood pressure. Prevent future flares. Making changes to your diet and lifestyle, such as losing weight, limiting alcohol, eating less purine-rich food, like red meat or organ meat, may help prevent future attacks. Changing or stopping medications associated with hyperuricemia, like diuretics, may also help. Prevent tophi and kidney stones from forming as a result of chronic high levels of uric acid. Tophi are hard, uric acid deposits under the skin. For people with frequent acute flares or chronic gout, doctors may recommend preventive therapy. It is to lower uric acid levels in the blood using drugs like allopurinol, febuxostat, and pegloticase. Xanthine oxidase inhibitors reduce the amount of uric acid produced by the body. However, these drugs can trigger an acute gout attack when you start taking them. They can also make an acute attack worse if they're taken during the attack. Colchicine. For this reason, people with gout are commonly prescribed a short course of colchicine when starting a xanthine oxidase inhibitor. Side effects of these drugs, allopurinol, febuxostat, include rash and nausea. Side effects of allopurinol include fever, rash, hepatitis and kidney problems. Febuxostat side effects include rash, nausea and reduced liver function. Febuxostat also may increase the risk of heart-related death. Medications that improve uric acid removal. Drugs such as probenecid, probalin, help improve your kidney's ability to remove uric acid from your body. Side effects include a rash, stomach pain and kidney stones. Gout surgery. Gout can typically be treated without surgery. But after many years, this condition can damage the joints, tear the tendons, and cause infections in the skin over the joints. Hard deposits, called tophi, can build up on your joints and in other places, like your ear. These lumps may be painful and swollen, and they can permanently damage your joints. 3 surgical procedures treat tophi. 1. Tophi removal surgery. 2. Joint fusion surgery. 3. Joint replacement surgery. Which one of these surgeries your doctor recommends depends on the extent of the damage, where the tophi are located, and your personal preferences. Active research is ongoing in a variety of fields related to gout and hyperuricemia. Scientists have found that high animal protein slightly increase the risk for gout. New drugs are being developed that may be more versatile and safe in treating the elevated uric acid levels in patients with chronic gout.